In states that are working hard to make sure that this law delivers for their people, we're seeing is that consumers are getting a hint of how much money they're potentially going to save because of this law. In states like California, Oregon, Washington, new competition, new choices, market forces are pushing costs down. Just yesterday, state officials in New York announced that average premiums for consumers who buy insurance in their new marketplace will be at least 50% lower next year than they are today. Think about that, 50% lower. So for people like Morgan who are self-employed, who have to buy on the individual market, they're suddenly going to see opportunities not just for the rebates we discussed, but also for even greater savings in their monthly premiums. So if you already buy insurance on the individual market, meaning that you don't get insurance through a big group plan through your employer, that could mean thousands of dollars a year that can go towards paying a mortgage, or putting a kid through college, or saving for retirement. And what this means is that hundreds of thousands of New Yorkers who don't have insurance will finally be able to afford it, because these exchanges, this big pool, is going to reduce the cost, and you may qualify for health care tax credits. Middle-class families will potentially qualify for these credits that will bring the cost down even more. So this is just an example of how the Affordable Care Act is doing what it's designed to do: deliver more choices, better benefits, a check on rising costs, and higher quality health care. That's what it was designed to do, and we're already seeing those effects take place. Now, I mention all this because yesterday, despite all the evidence that the law is working the way it was supposed to for middle-class Americans, Republicans in the House of Representatives voted for nearly the 40th time to dismantle it. We've got a lot of problems in this country, and there's a lot of work that Congress needs to do. Get a farm bill passed, get immigration reform done, make sure we've got a budget in place that invests in our children and our future. And yet, instead, we're refighting these old battles. Sometimes I just try to figure out why. Maybe they think it's good politics, but part of our job here is not to always think about politics. Part of our job here is to sometimes think about getting work done on behalf of the American people, on behalf of the middle class and those who are striving to get into the middle class. This is a big country, and the healthcare industry is massive, and there are tons of providers. And so as we implement, there are going to be glitches, and there are going to be certain states that for political reasons are resisting implementation, and we're just steadily working through all that stuff. The same was true when Medicare was started. The same was true when Social Security got started. There were folks who, for political reasons, resisted implementation. But once it got set up, people started saying, this is a pretty good deal. It gives me a little more security. Affordable health care is not some privilege just for the few. It's a basic right that everybody should be able to enjoy. So we're going to keep fighting to secure that right, to make sure that every American gets the care that they need, when they need it, at a price they can afford. That's the America we believe in. That's what families deserve. That's what we're going to keep on working to deliver. If the folks who have been trying to make political hay out of this thing, if they had some better ideas, I've already told them I'm happy to hear them. But I haven't heard any so far. What I've heard is just the same old song and dance. We're just going to blow through that stuff and just keep on doing the right thing for the American people. So thank you very much. All right.